Hey folks, this is Dr. Timothy Lineski with Lake Cumberland Rheumatology. I wanted to talk to you a little bit about methotrexate and discuss some of the common side effects, symptoms, improvements, and what to expect when you begin this medicine. Methotrexate has been in use for rheumatoid arthritis for more than 20 years. It is a medication that is generally given as a 2.5 milligram tablet. At our office, we generally started off with 5 tablets once a week, with the maximum dose being 10 tablets once a week. Methotrexate is called a disease-modifying anti-rheumatic drug, which means that it not only makes your symptoms improve, but it also halts the progression of rheumatoid arthritis. It is also used in other diseases as a steroid-sparing medicine, which means that we use it to substitute for prednisone or Medrol to try to lower or get you off of that medication. Methotrexate is generally given with folic acid, at least in the United States. We give it every day except the day of methotrexate because methotrexate, if taken with folic acid, the medicine will not have as much efficacy. So basically I tell my patients that folic acid is the antidote of methotrexate. Methotrexate actually only has a half-life in your blood system for about 6 to 8 hours, but its effect on the immune system is obviously much longer. That's why we give it once a week. Some of the side effects of methotrexate include liver function abnormalities and bone marrow discrepancies, which generally can mean low white blood cell counts or low platelet counts. We monitor this with routine blood work, which you should have done at least every 3 months with your rheumatologist. The methotrexate other side effects include alopecia, which means thinning of the hair, oral ulcers or sores in the mouth and nose. You can develop a very rare disease called methotrexate lung, where the body reacts in the lung against methotrexate, and it can cause some other side effects which are more rare. Methotrexate, as a general rule, is a medicine that is used as a first-line agent. Essentially, if you have rheumatoid arthritis, especially blood-positive rheumatoid arthritis, you should be on methotrexate because it has the most data as a first-line agent compared to sulfasalazine or leflunomide or Plaquenil. Methotrexate, the way that it works in rheumatoid arthritis is, as I tell my patients, the first time you take the medicine, it can make you feel nauseous. The second time, nauseous. The third time, less. And the fourth time, none. The medicine takes about 3 to 4 months to have a full effect with the rheumatoid arthritis. So the first time you take the medicine, you shouldn't expect, my hands and my joints are doing so much better. If that's the case, then you probably also have some steroids, prednisone or Medrol in your system from your physician. So in summary, methotrexate has been in use with rheumatoid arthritis and associated diseases for greater than 20 years. Its safety profile is favorable, although you do have to follow up with your rheumatologist routinely, especially to do blood work, because if your liver function tests are up or your blood or your bone marrow